Here's an important issue that I think we do need to discuss, and it's in regards to healthcare in this country. As I said before, the United States is the richest, most powerful country in the world, yet we lack the ability to take care of our people. And if we look at the member states of the European Union, Canada, as well as numerous other countries, they have single-payer health care, some form of universal health care, and we don't. And when Bernie Sanders held a town forum online, he had many representatives from different countries and asked them, well, what would happen if your country adopted our American, healthcare system? And most of all the international representatives would say we would have a serious problem. People would be upset. There would be a revolt in the streets. Why is it that there's been such a resistance, at least by our political leaders, to embrace single-payer health care, universal health care?
My theory.
Yes.
My theory is capitalism. It's not about the safety of the patient. It's about the wealth of insurance companies maintaining that stance. If you have a single payer, that cuts out the middleman. Then you will have to regulate pharmaceutical companies. They lose out in terms of revenue. The patient wins because they get good health care. They don't have to pay as much. As in Medicare, you do have to pay a supplement, very small. However, you do have to pay a supplement, and you can get an extra supplement if you choose. Under single payer, and I believe if you educate the country about it, they'll go for it. And then they need to knock on the doors of their elected officials to make this happen. But it's a very hard road. National Nurses United is fighting hard for single payer. They have the vision that we can do this, but it's going to be a hard road. I believe in the United States the issue is education on the social issues and our health issues to get the people to understand what is needed. Old ways are hard to let go in terms of insurance companies, and don't think the insurance companies are trying to lobby to fight against it. The pharmaceutical companies are lobbying to fight against it as well, because now these exorbitant prices that you pay for pharmaceuticals, where some people have to make a decision between their medication or their food. And people will choose their food over their medication. And so now their disease process worsens because they can't maintenance it with meds. They have gone up, they have gone up on diabetes medication. Diabetes is one of the leading diseases in the United States, as well as heart disease. So you can imagine if people chose between their diabetic medication, their heart disease medication, and their food. And that's what's going on now in this country.
And not to mention that the food industry, it's a little bit of a separate subject, but the food industry itself is not helping the process in any way whatsoever.
It's unfortunate that everyone is... corporations are in cahoots with each other. The food industry, the water industry, Flint, Michigan. Okay, so they have their water. They have to pay for it, but Nestle had to pay $2 for fresh water to distribute fresh water. But Flint has been fighting for fresh water for 2 years now, 2 years, 5 months. I must say that National Nurses United, we were there as well, handing out water. We always like to, protest. We were there too. We were on those fronts. Environmentally speaking, we were at the pipeline. We were there as well. We were on all fronts.